Hello, my name's Eleanor.
Hello, I'm Georgia.
Hi, I'm Yoasha.
Hello, I'm Tamara.
Hi, we are Hugh and Sidoni.
And we are part of the
Brighton
Grassroots
team for Results UK. So I'm just going to give you a quick overview as to what Results UK is and does. Results itself is a global charity focused on alleviating poverty, strengthening global health systems, and improving access to education all around the world. As an organisation, we have a specific focus upon change through policy, so we have what's called Grassroots Networks, which is what we're a part of. These are bottoms-up groups who write to and meet with MPs from all parties across the spectrum to ask for their support in changing policy. We're from the Brighton group, so frequently met with MPs like Caroline Lucas and Lloyd Russell Moyle to ask for their support in our cause. For us, we have been really lucky to have such supported members of Parliament who often share our views. However, other groups across the country have had more of a challenge to obtain parliamentary support. Despite this, our network is always expanding and strengthening, so perseverance has become a core trait for us, and we're always learning new things. Getting involved with the Covidarity Festival seemed a great way for us to discuss in more depth equality and sustainability and how this specific links to our cause. One of the slogans for Results is that voices can change the world, so it's important that we use our voices to greater educate others on the threats to equality posed by rising global poverty. So in this video, we're going to discuss global health systems quite frequently. So if you don't know what that is, a strong global health system is outlined by the World Health Organization by 6 key pillars: service delivery, health workforce, information, medical products and technology, enough financing for the system to actually work properly, and strong leadership. So without these 6 key factors, a health system within a country is vulnerable to failure or collapse. So what we want to do is use our aid budget to help support other countries in building up their health system to protect the most vulnerable. This is more important than ever, as because of COVID-19, over 60 million people are vulnerable to falling into extreme poverty as a result of the pandemic. For some, this figure won't be surprising, but for others it's astonishing, especially as this will mean that global poverty will be the highest since the Great Depression. Although, saying this, it's important to recognise that the figure of 60 million is an estimate, and it's not set in stone just yet. Society today is vastly different to how it was during the Great Depression, so we have a responsibility to act as a global community with the technology and reach that we have to reduce the long-term impacts that COVID can have.
It is undeniable that health and poverty are intrinsically linked. According to BMA, children in Britain living in poverty are more likely to suffer from chronic diseases and diet-related problems. This can be as a result of a range of factors such as access to services, lack of affordable nutrition, high stress levels due to money concerns, amongst others. If we expand those factors to lack of clean water and education regarding nutrition, it becomes easy to recognise that those countries and remote areas that lack the infrastructure of strengthened health systems will have worse off levels of health as a result of high poverty levels. This creates what is known as the health poverty trap. Poverty leads to worsened health, which reduces the ability to work or sustain a career, deepening an individual into poverty. Poverty therefore becomes both a cause and consequence of poor health.
Another common issue in countries that are most affected by epidemic outbreaks is a subsequent epidemic of misinformation regarding virus spread and the stigma associated. In a talk from the Director General of the World Health Organization, Dr. Tedros Adhanom, the Results Network was specifically asked to aid in tackling this epidemic as it is a major threat to our ability to combat COVID-19. We all have a role to play in dealing with this issue, even on the micro scale of spreading accurate information to our family and friends. If or when a vaccine does come out, there are worries about its accessibility and whether the NHS will be able to afford it as available to everyone. These concerns are extended to lower and middle income countries too, and so it is important to have strong health systems in place to ensure that the vaccine is available to all. We will later discuss the role of the global organisation of Gavi, the Vaccine Alliance, and the importance of global solidarity in ensuring equal access to said vaccine as and when it becomes available.
Brighton was one of the first places in the UK to have confirmed cases of COVID-19, so the threat to our community has been present for months. Thankfully, the community has come together to help mitigate the spread. One of the most significant impacts of COVID is undoubtedly its effect on our tourism sector. Unfortunately, Brighton and Hove City Council has had to deter people and ask them not to visit the city despite the heat waves over the past months. This is incredibly damaging to the local economy, especially the smaller independent shops that rely on tourism for income, in addition to the large student community that have been left struggling to pay rent due to being out of work. This being said, larger organisations have stepped in to support, such as Brighton and Hove Albion allowing their stadium to be used as a mass testing centre, and Sussex University aiding in the production of PPE, such as face shields for frontline workers.
Additionally, a number of hotels and refuge centres in conjunction with the Street Outreach Service have allowed rough sleepers to occupy rooms that are otherwise not being used by visitors due to the pause in the hospitality industry. With the numbers of rough sleepers increasing monthly in Brighton, this is a massive act of solidarity and a step towards dealing with an issue that will undoubtedly be worsened by COVID. This is in conjunction with the national food parcels organised by national government, as well as the countless volunteers such as those from the Real Junk Food Project that have worked to cook and deliver thousands of hot meals to frontline workers and rough sleepers. These initiatives highlight the importance of national and local organisations in tackling poverty, especially in Brighton. As we touched on earlier, the poverty health trap is a cycle that can only be broken with sufficient financial and social support. Therefore, we must push to ensure that these kinds of measures are continued and strengthened in a post-COVID world.
In February, results advocates from across the country went to lobby in Parliament to request that the Prime Minister supports our £1 billion replenishment for Gavi, the Vaccine Alliance, who can provide vaccines in countries that lack the funds and facilities for widespread immunisation. The Replenishment Summit is held every 5 years and that invites the 52 donor countries to make the pledges to fund Gavi. This year, it was hosted right here virtually in London by Prime Minister Boris Johnson. Gavi has already protected 760 million people against 18 of the world's deadliest diseases. Before the summit, to try and help secure the funds needed, we met with Lloyd Russell and Caroline Lucas, both MPs, for their support in encouraging the Prime Minister to replenish the UK's support, of which they gratefully did in the form of letters to Boris Johnson. Right now, in the midst of another global pandemic, the health of our loved ones is a priority for most of us. Thus, it is imperative for us to come together as a global community and provide the necessary support for countries that do not have strong existing healthcare networks. With the work of Gavi, the total number of lives saved is expected to exceed 7 million, of which will reap the economic benefits of the $1 billion by 2025. Arguably a remarkable figure. And we are very grateful that the UK increased their pledge, which aided in Gavi exceeding the last replenishment total. As previously mentioned, Gavi and its extending network has never been more vital resource than today. Hence the development of the COVAX programme up to new clinics with vaccines and reliable information sources will be vital in the fight against COVID-19.
On Thursday the 25th of June, myself and my fellow Results Brighton member Sidonie East met with Lloyd Russell Moyle, our MP for Brighton Kemp Town, to discuss the Global Fund's COVID-19 response mechanism. The world has agreed to end TB, an aggressive infectious respiratory condition that often affects marginalised communities, alongside HIV and malaria by 2030. But COVID-19 lockdown restrictions and the redeployment of resources are stopping people who are ill with these diseases from accessing the healthcare they need. This is threatening to reverse progress made to end TB, HIV and malaria, and is highly likely to cause millions more deaths in the coming years. The Global Fund is a global organisation which already works on those three diseases and so is able to quickly and efficiently help countries deal with COVID-19 and then in turn minimise the impact it will have on services for other diseases. We believe that the UK should support the international response to the pandemic through investing in the Global Fund's COVID-19 response mechanism. And when we spoke to Lloyd about this, he was really engaged with the issue and spoke to us about his trip to Liberia with Results a few years ago to visit drug-resistant TB patients. We discussed some of the really horrible side effects of the drugs used to treat it, such as hearing loss. And in India, after Prime Minister Modi announced the nationwide lockdown on the 24th of March, the public health system has been directed primarily towards COVID-19 response and prevention and treatment. But the shutting of the outpatient departments in the hospitals has severely affected those with other diseases such as TB. The consequences have been serious, with the lockdown leading to a sharp drop in the diagnosis of TB, which in turn could increase the transmission of the disease through undiagnosed patients. Even among patients who have been diagnosed, the restrictions on movement have made it really, really difficult to access the regular treatment that they so badly need, which can have irreversible effects of the infection developing a resistance to the life-saving medication. So the consequences of interruptions in treatment can be severe, because a failure to complete a course of medication can lead to the bacteria that causes TB to develop resistance to the drugs that fight it.
Lloyd agreed to send a letter to the Secretary of State for International Development, Anne-Marie Trevelyan, asking that she supports investment into the COVID-19 response mechanism. This is one really important way in which MPs can represent your views. If you ask your MP to do this, they are obliged to pass on your concerns. As in recent news, some of you may be aware of the merger between DfID and the FCO. This is not something that we support, so it's a necessary topic to discuss. The Prime Minister is merging the FCO and DfID, but we don't see foreign aid and foreign policy as the same thing, and believe that this merger risks the quality and transparency of UK aid and moves the focus away from poverty reduction. I think it's clear that aid well spent is especially important right now, given the impacts of the COVID-19 pandemic and a predicted global recession. We believe that retaining separate departments is the best way to keep UK aid focused and effective. As a minimum, aid should only be spent on reducing poverty. Aid and development should have a cabinet-level minister who champions poverty reduction and achieving the Sustainable Development Goals. And aid spending should also be scrutinised by its own parliamentary committee, separate from foreign policy. Lloyd assured us that the Labour Party will be opposing this merger. He has written a letter to the Secretary of State for International Development opposing it, and has written 6 questions to be addressed to the PM, the House, DfID and the FCO, asking them what advice they've had on the merger and ensuring that a separate committee is maintained. He cares a lot about DfID and is trying to help as much as he can behind the scenes. It's vital to engage our local politicians in serious global issues such as this. Small-scale discussions with local politicians on widespread global issues are so important for effecting change.
We wrote to Caroline Lucas to secure her support for the UK government in joining other countries in channeling a portion of the COVID-19 response through the Global Fund. She responded by highlighting her support in signing a cross-party letter to the Prime Minister calling on him to provide urgent support to the world's poorest people in this crisis, as well as her signing of an early day motion condemning the merger of international development and the Foreign and Commonwealth Office. This also included calling for the government to guarantee that aid will continue to be focused on poverty reduction.
It is important to make connections on all scales because health is a global issue with consequences for everyone. In the era of globalisation, where global trade and travel are frequent, the spread of infectious disease grows rapidly. For instance, migration, business activities, displacement and tourism are all ways that lead to the increased mobility of humans and therefore the spread of disease. Because healthcare is largely seen in economic terms, it is a commodity to be purchased by consumers within the marketplace, and so expenditure on health is generally based on its economic returns. That is why infectious diseases such as COVID-19 and SARS receive greater amounts of aid rather than going towards developing health systems and poverty alleviation.
This is why our work at Results UK is important in bringing all these factors together and not forgetting the goal of eradicating poverty while improving healthcare outcomes for the most marginalised in society. As we have said, these two components are interlinked, and so improving healthcare should not just be seen in terms of economic returns, but rather a way to improve one's well-being and access to resources. It is crucial that we use our voices to try and influence the political sphere to eradicate poverty. We have meetings in our local results group every month where we can bring together ideas to implement our monthly actions. We also have a monthly nationwide call where we can feed back our ideas to other members of Results in different parts of the country and hear from expert speakers on different aspects of ending poverty. We have met with our local MPs to discuss the UK's role in the global response to COVID-19 and how the UK can ensure that other healthcare goals such as ending malaria, HIV and TB still need to be prioritised. This is an example of how we can utilise political avenues such as simply contacting your MP to effect change on a global level. again highlighting how important it is to discuss these issues on a local scale within the Brighton community.
So just to finish up, the big question here was, if strengthening global health systems is a global issue, then what does that mean for me? As we've discussed, having communications on different levels is paramount. And as a grassroots network, we really do believe that we can make significant change from the bottoms up. Health has always been a global issue because we're only ever as strong as our weakest health system in such an interconnected world. This can be seen very clearly in the current COVID-19 situation. Health is also intrinsically linked with poverty. Therefore, we all have a role in ensuring that everyone has equal access to resources, including healthcare and education, which will lead to our wider goal of ending. Now, if you're interested in being part of our team and using your voice to create global change, then please get in touch with us at Results Brighton. If you're from a different part of the country, have a look on the Results website to see if there's a grassroots team near you, or maybe set your own one up. And for more information on what we're doing and policy changes, then sign up to our newsletter at www.results.org.uk/subscribe. Now, if you've got any questions, we're going to be available this afternoon on Jitsi for a little Q&A. If you're looking at this later on, then you can drop a comment below and we will be monitoring the video for a few days and replying. And for all that information together, have a look in the description box. Thank you for watching, and I really hope this has been informative.